Good morning, everyone. Today's topic is tumors in the region of cavernous sinus. Cavernous sinus mass has a wide differential diagnosis, which includes meningioma, orbital apical inflammation, which involves cavernous sinus, infections, schwannomas, any involving any cranial nerves traversing the cavernous sinus, that is third, fourth, fifth, and the sixth nerve. Trigeminal schwannoma is the most common. Cavernous hemangioma, lymphomas, metastatic disease, especially when the spread is perineural. Aneurysms, hemangiopericytomas, neurosarcoidosis, the pituitary adenomas, and skull-based tumors such as chondrosarcoma, osteosarcoma, chondroma, and juvenile angiofibromas. Nasopharyngeal carcinomas may have intracranial extensions. So this is a case of a 48-year-old lady who presented with headache and reduced vision of the left eye for 1 month. MRI revealed a lobulated extraaxial altered intensity lesion which measured 3 into 1.7 into 2.2 centimeters in the region of the left cavernous sinus. It was causing moderate luminal narrowing of the internal carotid artery with maintained flow void. This lesion was isointense on T1 and heterogeneously hyperintense on T2 and FLAIR images. It shows a homogeneous post-contrast enhancement, adjacent pachymeningeal enhancement along the anteromedial convexity of the left lobe. So we received this flat, irregular gray white tissue piece in the lab, and the histopathology revealed a tumor with the fibrous capsule, and the tumor was composed of meningothelial cells arranged in whorls and bundles. The cells have round to oval nuclei and a moderate amount of eosinophilic cytoplasm. Mitotic activity was absent. So we gave a diagnosis of meningothelial meningioma, CNS WHO grade 1. For knowing the details of meningioma, please click this link in the description box. Now, the second case is of a 62-year-old man who presented with headache, and on examination, he had right jaw and left temporalis muscle weakness. Uh, his imaging revealed a well-defined extraaxial lesion over the right medial temporal region extending over right CP angle, abutting the sellar region, and the intracranial portion of the right optic nerve compressing medial temporal lobe and basilar pons. And this lesion measured 38 into 22 into 22 mm. It was hypointense on T1 with intense restriction on diffusion weighted sequences. And the lesion was hyperintense on T2 with flare showing heterogeneous subtle hyperintensities. So we received this whitish gray white tumor with, you can see these pearly white areas. And the histopathology revealed a cyst wall lined by keratinizing stratified squamous epithelium. Skin adnexia or hair follicle were not found, so the dermoid cyst was ruled out. You can see the subepithelial tissue is fibrocollagenous and the lumen contained abundant flakes. And one should remember that rupture of epidermoid cyst may lead to foreign body giant cell reaction and even abscess formation. So we gave a diagnosis of epidermoid cyst involving the right temporal lobe and the cavernous sinus region. For details of the epidermoid cyst, please click the link in the description box. Now this is a case number 3. A 45-year-old man presented with drooping of eyelid and diminished vision. MRI revealed a well-defined multilobulated lesion which measured 2.5 into 3.5 into 2.7 centimeters, which was hypointense on T1 and hyperintense on T2 and FLAIR images. And, and it was not showing diffusion restriction and showing progressive intense post-contrast enhancement on dynamic contrast study in the left paracellular region, probably arising from the left cavernous sinus. So we received this in our lab. Almost the lesion measured 1 into 0.8 into 0.5 centimeters, and histopathology revealed a vascular tumor composed of numerous large cystically dilated channels which were lined by endothelium, and the intervening stroma showed areas of fibrosis, and hemorrhages were also noted. So we gave a diagnosis of cavernous hemangioma of the left paracellular region, and it was also involving the left cavernous sinus. So for description, detailed description, you can please do click over the link in the description box. And thank you very much for patient listening. Do like and subscribe my channel.